neck exam is going to look at a number of things. One of the big items would be palpating for what's called thyromegaly, or an enlarged thyroid. They may describe the trachea, sometimes in trauma. If there's some swelling or injury, the trachea may be deviated, so you may hear tracheal deviation. The other cause of tracheal deviation could be if there's a pneumothorax, which we'll get to when we get to the lungs maybe, and that is collapsed lung, and that can sometimes pull the trachea one way or the other. They may also palpate some of the muscular structures in there, and we have sternocleidomastoid here, and we have in the back on the neck, we have the trapezius, or part of the trapezius going up to the base of the skull, but we'll get into a little bit more of that with musculoskeletal. There are also some lymph nodes there, which we'll cover in a different body system.
Lymph?
So on the lymphatic exam, mostly the one that we're checking is the lymph nodes in the neck. You'll have some submental nodes or submandibular nodes. The mentum is the chin, the mandible is here, so there are some lymph nodes that can be checked there. Most commonly, we're checking in front of the sternocleidomastoid a chain called anterior cervical nodes, and there are also behind that muscle another chain of nodes called posterior cervical nodes that we will frequently check. Those are the big ones, but sometimes you may have a physician talk about supraclavicular nodes above the clavicles, sometimes epitrochlear nodes, which are around the elbows, and then there are inguinal nodes that are down in the inguinal area of the lower abdomen at the crease between the abdomen and the thigh.